joined now by the President and Chief Executive Officer of Dana-Farber Cancer Institute, Dr. Edward Benz, who comes by every year to talk about the amazing work. But this must be a little bit bittersweet for you here. You'll be retiring later this year. So watching this telethon again and thinking of all the money that's been raised over the years and all the progress that's been made, what's it like for you?
Well, it is a bittersweet thing. It's been wonderful to be the president of this great organization and to be able to benefit from so many people's generosity and to see the advances that are being made. And I have till October 1st, and then I'll be handing over the reins to my successor, Dr. Laurie Glimpsher, who's going to be a fabulous president of Dana-Farber.
You and David Ortiz have had tremendous careers here at Fenway over those years. You talk about the advances. What have you seen? If you can compare where we were in this fight 16 years ago when you came into where we are now, how different is it?
Well, when I started here 16 years ago, most of the people who came in to see us in clinic were still getting treated with what we now would call conventional chemotherapy, you know, the so-called carpet bombing drugs. Now, substantial numbers of our patients are being treated with two new, very exciting approaches to therapy. One is targeted therapies, where we find the genomic abnormalities, the genetic vulnerabilities in a cancer, and target that vulnerability with a specific drug. Much more effective, much less toxic. And then in the last 5 years, due in part, no small part, to Dana-Farber's leadership, that we are starting to use immunotherapy, where actually we are finding ways to harness the power of our own immune systems to fight off the cancer. And I think the next big step that I'll be watching with great interest from the bleachers is combination of the two. And I think that's where we're really going to start seeing very, very dramatic improvements in survival.
And it's a simple and obvious statement, but all of this takes money, which is why we're asking people to pick up the phone and do it. But we talk a lot about the care, and rightfully so. We're going to share stories of patients and the work being done on the one-on-one basis. But the research and the clinical work being done over there is very costly, and that's why you need the money.
Exactly. You know, the research is becoming increasingly costly. The good news is we have these incredible technologies now. The bad news is it's technology, and it's very, very expensive. We have to have huge teams of scientists now to do projects. The federal government and our faculty are fabulous at getting their grants. They get all the grants as possible for them to get. But that still leaves us with somewhere between 20 and 25 cents on every dollar we get from the federal government. That is the shortfall that we have to make up with the kind of funds we get from this radiothon.
And this radiothon, the Pan Mass Challenge, have really become great fundraisers. Is this an exciting couple of days? We were talking with Larry Lucchino, just so many stories. Like, I think it's just a way to bring the spirit of the place to a lot of people who might not know about it.
Yeah, you know, you've really touched on an important point for those of us who work at the Dana-Farber and work on cancer, and that is that the funds are fabulous and incredibly important and necessary, but these events put us in touch with the people who are benefiting, and I get to see people who have been treated with these new agents that have come out of this research who wouldn't be here if it weren't for that, and it lifts our spirits, and it gives us much more resolve to go back and keep fighting that great fight.
You've led the fight for 16 years. Congratulations on a wonderful career, and thank you, as always, for coming by.
Well, thank you for having me.
Come back next year. You'll be relaxed. You'll be, taking it easy, and you can still talk about it.
Yeah, I might have a goatee or something.
Goatee, you won't have to shave. Great to see you, Dr. Benz. Thank you.
Thank you very much.
We'll
Thank
come
you
back
all.
with more.
Yeah.
Thank you. Exactly right.